Many people out there think that doctors don't make mistakes, but we actually do. We don't just need healthcare, but we need quality healthcare. It means that we need not just healthcare being there, but we need the quality. So the quality. So that's what technology brings. A feature where you can ask anything that is medical. It's the AI mammography, which means that it can read from a breast image, breast mammography. It can read if there's a breast cancer or not, and it has a good accuracy because it is more than 97.1% of an accuracy.
Hello and welcome back to yet another episode of Define. I am so honored to be joined on Define by Dr. Kevin Muragijimana. He's a co-founder and CEO at DoctorAI Ltd. It's a Rwandan-based medical technology company that wants to modernize healthcare services in Africa. Dr. Kevin Muragijimana is a Rwandan physician who graduated from the University of Rwanda with a bachelor's degree in general medicine and surgery. Before co-founding DoctorAI, he interned at Centre Hospitalier Universitaire de Bicêtre in France in 2019. Dr. Kevin, it's a great pleasure to welcome you on Define.
Thank you so much. I'm very pleased to be here with you. And yeah, it's an honor. Thank you.
How are you doing?
I'm doing very great.
Why DoctorAI? Just the name.
Thank you. The name itself is, well, of course, as it sounds, it's as the letters of it, of how it sounds, it's a doctor and AI. So the AI stands for artificial intelligence. So we wanted to create an artificial intelligent doctor. So which is we name it a super doctor. So that's why it's like a superhero, but in the name of a doctor.
Great, very inspiring. Can you take us through the journey of creating DoctorAI?
Thank you. Well, talking about the journey as any other entrepreneur, I guess the journey of creating a company, creating a business, it always starts with an idea. The process of ideation, the process of having that idea of creating a business or a company. But for me and my co-founders, it went back. It's more than just an idea. It was more of how we lived and how we characterized ourselves in what we wanted to do. So if I can take you back, when I was in high school, I was that child who was always had to play with the computer, trying to do things, trying to edit some movies, edit some photos, So I was that child who always played with the computer, trying to deal with softwares. But that was just something I loved to do. But my overall dream and my overall goal was to become a doctor. So when I became a doctor, it was a bit more boring, if I could say that. So it was a bit more boring to just be a normal or a usual doctor. So I wanted to add something of my passion, which was the technology. The technology was the passion side of myself. So then luckily I had some co-founders who were my friends. They are actually my biggest friends, and so then it was easy to iterate my idea, to iterate the idea of creating, to bridging that gap of not just doing medicine, but also the medicine as itself, not just the medical part, but also adding technology to modernizing the healthcare, also bridging that gap of technology and the healthcare itself. It was also an idea that came from a pain that we had as medical doctors. Many people think that we are trained to be very accurate, to have a very good precision,
yes.
But we are not gods. We are not gods, and when you make a mistake, it causes it impacts the lives of people. So that's why when I created DoctorAI, we wanted to create something that can aid, can support medical doctors or healthcare professionals to improve, to enhance their clinical decisions, but in the end also the main goal was to improve the clinical outcomes or to improve the lives of the people.
Great. I know when I was reading a little bit about your company or DoctorAI, it came, yes, to bring precisions in the results or diagnosis and stuff like that. So I wanted you to take us through what does DoctorAI like literally do? What kind of services that you provide? What kind of techniques that you use in your work that sets you apart, that brings that uniqueness of who you are as medical doctors?
So what DoctorAI do right now, we have an application that is out there. It's a mobile application that have both mobile and web-based application. So it has the lab part, and you have the AI assistant part, which is a feature where you can ask anything that is medical. So you can ask anything that is medical, and it gives you an answer to any question that you are giving. So it is powered with the best literature that is there in medicine. So it gives you the answer to anything that you think it's medical, and it's with great precision, and also with a good summary that a doctor needs. So and then apart from the AI assistant, it is my favorite feature that we also have the AI lab, which is a lab. We call it lab because there are a lot of other investigations that are being done, and also that we want to create. It has the first feature that is in it is the AI mammography. Mammography is a tool that uses that can detect breast cancer. It actually uses rays to picture the breast of a human, and then you can read from the X-ray from the image, and then you can tell if there's a breast cancer or not. And it has a good accuracy because it is more than 97.1% of an accuracy. And then there's also that is one. There's also AI for chest X-ray, which is chest X-ray. Of course, it's an X-ray of the chest, so it reads X-ray images that were already created, that were already provided, and it can read chest X-ray and provide interpretations. Yes, interpretations from a broad range of chest abnormalities and anomalies. It can tell if you have any chest or lung abnormality from just picturing the chest X-ray. So our features are very quick because we have in less than 10 seconds you have results in less than 10 seconds, and then so you can understand how much it can read. So that's why I'm saying that we emphasize on the precision, but also with the quality and the accuracy of the models. They all have more than 95% accuracy, and they're actually growing. It's not going to go down. They're growing, so we want to achieve 100% of an accuracy.
So as technology grows, so the systems also grow. So
as they are fed with data, they are also the model is also growing and learning and also developing. So that is a baseline. That's the baseline accuracy that they have, but they are only growing.
Fantastic. This is really amazing. I got intrigued actually when I heard that you can have that accuracy up to above 95, somewhere there. And I just wanted to ask you the infrastructure that you use. I know you can't be operating, for example, in Rwanda if they're not tested and approved by the Ministry of Health. I wanted to hear that accuracy and that credibility, where you can tell the infrastructures are there and people can actually come to us and get tested or get their results in that very short time.
Well, of course, the DoctorAI itself, it's as I said, it's a bit of a startup because we founded. It was the idea itself was founded in 2019, but we registered in 2021. So they are in the recent years, we are more focused on the production of those models because it takes a lot of time and a lot of technology and a lot of things to have the model have that accuracy. So we were mostly focused on the production of those models. So those models are in the phase where you can use them, but for the for personal use, they are not now. They haven't been tested on the larger scale, or being tested on the bigger market. So which is the phase where we are entering. So I mean, right now you can download it on stores and use it. Yes, and
yeah. So if someone wants to test those features or those applications that you have, what is the procedure? Do they need to have a recommendation maybe from the medical doctor? Do they need to just randomly get on the app and start using the platform?
Well, so this app was actually made for healthcare professionals, first of all, because it is being used to support healthcare professionals to have that accuracy and that support from another application, a software application. So for someone who wants to use it, you can just download it from stores. It's easy. You get it from App Store or Play Store. Then you can use it. We wanted to make it, first of all, accessible, easy accessible, because I don't think it's the first of its kind of having such an idea, but the most difficult thing now is to have them accessible. Yeah, I know that there are other companies that are doing maybe the same or doing close to what we're doing, but the main issue for such companies is to have an access to their product, or to have to the product itself, or to the applications. So for us, we wanted to make it easy and easy accessible for people any healthcare professional who want aid or who want support, so he can just download it from the stores. He or she can download it from the stores. Yes, and
fantastic.
Yeah.
I wanted to jump on the success stories. If there's any that you can share for now, maybe healthcare professionals who have used it in their practicing. What are they saying?
Well, the best success story that we have is that when we launched this application, we wanted just to throw it on the stores and see the reaction of the people. We didn't expect to have a number as what we have, because we are close to our 10K users right now.
Oh, great.
Close to our 10K users. We didn't think that we would reach such a huge number. So it shows it's in less than 1 year that we launched the app on stores. So it showed us that the app is actually needed, and then people really need help. Healthcare professionals mostly, they really need help. And then so that's the most successful story that I think I have, is that we saw that people actually need it, and it's not just locally, because most of our users are from the US, and then Rwanda it only takes less than 10% of the users. So most of them are from abroad. So you can see that then it gives us a joy that it's on the standard where even people from abroad, from the US, from Europe, they think that it's of good quality, because we have huge numbers, and they're mostly from those countries that are based
developed. They have healthcare is really developed. Maybe if you have done maybe analysis, do you know why maybe Rwandans are not using it on a bigger scale? I know that this is something new also in Rwanda, as technology, AI is really growing, but it is of recent here in Rwanda, maybe in Africa as well. I wanted to hear your point on analysis. If you try to understand why less in Rwanda and maybe more elsewhere or abroad, what could be the causes?
Well, if I could assume the causes of or what can cause Rwanda not having the huge number of people using it, can be apart from us, maybe also apart from them, because I don't know if they have that. If they have that habit of because for you to download the app, of course, right now, because we haven't done any marketing, so you can understand. That's why we say that it's a joy, because we have 10K without doing any marketing.
Oh, great, yeah.
So I can say that apart from us, because our part is that we haven't done any marketing to them, so we cannot blame them from not
using the platform,
not using the platform, because we haven't done any marketing so but also another part is that maybe that they are not searching very much of those applications, maybe because they don't know, they are not sure if there are any, or maybe just because they haven't heard of any application of such kind. So sometimes it might be because they are not aware that such an application can exist or can be as accessible on stores as it is for our application. So it might be that, there might be other factors, but I think that might be those factors.
Those few we can think of right now. So that leads me to another question that I wanted to ask about that shift from traditional way of doing healthcare wellness in Rwanda to compare it to now using technology and the recent technology in healthcare. How do you see that shift in Rwanda? And how do you see technology playing a role? Because people might, of course, because they have been doing or using traditional medicine, traditional healthcare, practicing, if you tell them about the new technology, AI, and other platforms, people might be skeptical, or they might think this is not maybe something that we can trust. How do you see that shift in Rwanda currently of people now starting thinking other ways they can benefit from the technology around healthcare and wellness?
Yes, when I think of this shift of healthcare to becoming more technology, it's I used to think that medicine is otherwise not different from the medicine of Stone Age if there's no technology. If there's no technology, there's no actual difference, because there have been medicines, or there have been medicine, there have been healthcare since the human, since the human came to Earth, the medicine was there. So the medicine was there. So there's no difference if we don't add technology. There's no much difference. Maybe I can say that there's no much difference if we don't add technology, because that's what can differentiate from the eras of the modern era and the Stone Age era. So when this shift of technology, it can also it also means a lot of things. It means that we don't just need medicine, or we don't just need healthcare, but we need quality healthcare. It means that we need not just healthcare being there, but we need the quality. So the quality. So that's what technology brings. That's what technology brings. It brings the quality to the healthcare that was there, but then there's quality, there's precision, there's accuracy, there's accessibility. With that, technology brings a lot of things. There's a lot of things that technology can add. So, but we didn't think before. So now Rwanda, which is a country that in Africa has maybe among the best landscape of technology, best geographical access and technological access on this technology. So now it's up to us, because Rwanda itself has made, it has made the infrastructure, the technology infrastructure available. Now it's up to us, people in healthcare, to use them,
benefit them from
to benefit from that opportunity that we have of having the infrastructure ready. So that's the shift that technology brings. It brings that accessibility, which is what we need more. It's accessibility, but not just to healthcare itself, but to quality healthcare.
Absolutely. We are about to take a short break, and we'll come back after a while. We are back again. I am together with Dr. Kevin Muragijimana, and we are talking about revolutionizing healthcare using technology, like recent technology. Dr. Kevin, continuing with our conversations, I wanted to ask you where you would like to see DoctorAI maybe in 5 years, 10 years, where do you see this Dr. AI going?
Where I want to see Dr. AI is mostly I would say that I actually want to see healthcare professionals or doctors not being alone. That's how I would say. I want to see people or doctors or medical professionals relying on Dr. AI instead of being just alone. So I want to see them using Dr. AI as a tool that can support them and having confidence in the application itself. That's where I want to see Dr. AI. So saying that, which means also I would like to see Dr. AI becoming one of the best, or maybe the best reference for medical or for healthcare professionals. So using this Dr. AI as a huge reference for them to in their daily lives of consulting or caring for the people.
Good. I'm hoping that maybe those who are listening to us or watching us, some of them are medical practitioners who would like to test it out and try it out and see how it works. What is the message that you would like to give to them? And if there's anything that you can tell to ordinary people, like who are maybe curious, who want to learn more about this platform. I heard that it has two sections or two platforms itself. One which you can go to and learn about something or inform yourself about something regarding your health, maybe health issues, or just want to learn something. And also the lab part that helps medical doctors to be more precise in their diagnosis, in their work. What kind of messages would you give to those two people?
The message I would give to healthcare professionals is that they are no longer alone. They are no longer on their own. They have a platform that can support them in their decisions. And to the society, to other people who are not just in the medical field, I would say that now their doctors are more precise and accurate than before. That's the message that I would say to them, is that their doctors or their healthcare professionals are more precise and accurate than they were before with the use and the presence of Dr. AI. In short, I can say just those few words.
That's fantastic. That's really good. So I am so eager to learn more about this application, and hopefully after this episode is out, you might get questions. I wanted to ask also, if people want to reach out, where can they reach out on? Is it on the app? Are you comfortable sharing maybe your email or maybe the website where they can go and maybe ask a question? If you've got questions or any other inquiries, you can reach out to DoctorAI through their website. Go to www.DoctorAICompany.com, or you can send them an email through info@DoctorAICompany.com. It's a great pleasure having you on Define, and I myself have learned a lot about how you can leverage technology to maybe learn more about healthcare and wellness, and also maybe for the doctors also, if there's any application or anything that can help them be more precise, because I know how painful it can be to get the wrong diagnosis that can lead to death actually, or complications with your health. And since we have this, I believe it's one of the ways, one of the thing or platform that is going to help reduce those possibilities or those consequences that patients or people face on a daily basis. So thank you for creating this.
Thank you.
Yeah. Well, that's all for today's episode. Thank you so much for tuning in. Please support this podcast and help us grow our reach by listening, subscribing, and sharing our content to your network. You can also leave a review with your takeaways. This helps us create the exact content you want. Stay blessed, and don't forget to be awesome.